And we're blessed because joining us now via Skype is Nicole surgeon Dr. Michael Pitman, who performed her surgery. And Dr. Pitman, number one, thank you so much. But before we get into that, the misdiagnosis of asthma, it's not uncommon, but quite a bit different than subglottic stenosis.
That is true. A lot of times we will see patients who have subglottic stenosis but have had asthma in the past. Because when you have a breathing problem, there are lots of different things that can cause that. It's not always asthma. So when you have a diagnosis of asthma, you're not improving with your inhalers, you have to think twice about what's going on. And in Nicole's case, she also had this whistling sound that we call stridor whenever she breathed, and that you don't get with asthma.
Tell us a little more about what you did exactly during this surgery.
Sure. So we decided to do a minimally invasive approach. Instead of opening Nicole's neck, we did the whole surgery through her mouth. And we exposed the area where the narrowing, or what we call stenosis, is. And then we injected it with some steroids to soften the tissue. We used a laser to release the scar tissue, and then actually put a balloon in the airway and inflated it to stretch the airway open.
And this is a one-shot deal. Nicole should be cured.
Yeah, I think in Nicole's case, this is probably a one-shot deal. This is an old scar. We've taken care of it. There's no reason that...
Well, Dr. Pitman, thanks for joining us. Excellent work. The proof is in the pudding. Nicole looks absolutely phenomenal. Thank you.
Good work.
And I do think it highlights something else I want to just remind viewers. You know, with asthma, it tends to be what we call expiratory wheezing. We all know what wheezing is, or we should, right? We've heard it. As opposed to stridor, which is more of an upper airway obstruction. Often, you probably, on inspiration, I'm assuming that you heard some of that noise, right?
Oh, yeah, always.
And that's, you know, that is a key differential out there. If you all notice that on inspiration, you're noticing this, we call it stridor, and we'll have some of those sounds on our website. You have to think twice about the diagnosis. But why I'm so happy for you is I understand that you've now, because you're 28 and you're finally healthy, that you've created a bucket list.
Oh, yes, yes. You know, it's just, like you said, living my life. I couldn't do anything. I couldn't have a conversation. I couldn't go out with friends and go to the mall and go shopping. You know, it was really difficult. I'd always, you know, I'd want to be part of the crowd, but it was so hard.
And we even got a little sneak peek at this bucket list.
Oh, no.
And we have a surprise for you. So, Steph, can you come on and join us? You said biking was something that you wanted to get into,
wow, so check that
we
out.
thought we would get you started.
That's a cool looking bike.
That is very cool. Yes, that is pretty awesome.
So, Nicole, get out there, embrace this young life of yours, and we wish you all the best moving forward. Thank you for sharing.
Thank you. Thank you. Thank you so much.